Do you want me to do anything, doctor?
Yes, please. Let's start with monitor and also saturation, please. My name is Danny Wildekens. I am a paramedic and one of the persons that own Secta Medical. Regular breath sound. Secta Medical is founded by medical professionals for simulation. The things we do here is we sell the products that make simulation more lifelike. We try to train the people and the way they have to perform. So train as you fight and fight as you train. We just take one blood pressure and then I'll see what I can do for you immediately against pain, sir. There are several levels of learning. The first one is theoretical learning. The second one is skills. Well, we do not perform skills here and theory, that's what they've done at home. But then we go into scenario training. Scenario training basically means we're going to put you in a lifelike situation and now you have to come up with your theoretical knowledge combined with your skills. Above scenario training, there is a fourth level, and the fourth level is simulation. And simulation interactions work, and people learn a lot from that.
Okay, dear candidates, we are just starting the scenario. If you look at the monitor, you will see some more information. Good luck.
Thank you.
We are trying to make by ourselves a system for debriefing, and with the system we really can give our customers a tool to have a debriefing system with everything what they need in the system.
The first time you did the scenario?
Yeah.
How did it feel?
It's a dedicated debrief program, which means that if we set everybody together around the television screen, everybody's taking a look on their own performance, but it's also filmed from different angles. And we can go back to certain moments which we can highlight and make sure everybody is seeing the same situation from different angles. And that's absolutely something very worthwhile, because then you can see your own performance and we ask the people to interact themselves on their own performance. And I think that's absolutely magnificent. Now we have the blood pressure, 140/95. So I think I'll hold this one for you.
Thank you.
I think we can... In the near future, I expect that walls like these, on which we can project, are quite common also in the hospitals. Not only for patients' rooms, but also in operating theaters, simply to influence the environment. We can bring people in another environment, but also give them the ability to gain extra information simply by tapping the wall, and then the pop-up screen will tell you everything you want to know.
Hi, my name is Tanner Andre, and I will be introducing you to the newest Simex product launch, the Virtual Mannequin Series. This series of cases includes a chest pain patient, abdominal pain patient, OB patient, pediatric patient, toxicology patient, and potentially several others. These cases are designed to replicate what you typically do with a high-fidelity sim mannequin. However, you can now practice in an immersive virtual environment and with a true-to-life virtual patient. As the facilitator, you will have complete control over patient dialogue, animations, vital signs, lab imaging, and exam results. In other words, the patient can have any diagnosis and require any treatment depending on the moderator's choices. The case I will be walking you through today is the Simex chest pain virtual mannequin case. Let me show you how it works. When you select Start Case, you will be given 4 patients to choose from, so that your students will not associate one specific patient with the chest pain virtual mannequin case. So for today, we will select Cecil Whitver and select Start Case. Okay, we're officially in the simulation now. Wes Anderson has joined us. You can see his orange head and orange hands, his avatar. You can see him in his living room, walking around, moving around. Wes, go ahead and wave to the camera for us. There he is. So you can see that he's going to be able to move around freely in his living room, just like you would in the clinical setting, this hospital setting. and be able to interact with the tools. So if he walks over to the stethoscope right now, he can go pick it up and walk over and place it on the patient's lung or heart. So let's have him get ready to see the patient. You can go wash his hands. I'll go first person view so you can see what he's seeing in the headset. And as he's washing his hands and donning gloves, I'll kind of show you the initial steps as far as how you're going to moderate this case. So once again, this is our chest pain virtual mannequin case, which means as the moderator or as the facilitator, you have complete control over what the outcomes are. This could be a STEMI, an NSTEMI, a pneumothorax. It could be something as simple as gastritis or anxiety. Maybe it's a pulmonary embolism. It's up to you. So we'll start with kind of the basics here. The most important part of almost all of our cases is the communication piece. So if Wes wants to talk to this patient, he can go ahead and open his mouth and start talking to the patient like he would in real life.
Hi, my name is Dr. Wes. What brings you into the ER today?
Okay, and patient can start talking back. So, hi, my name's Cecil. I started having some chest pain earlier this morning. So you can see I click the patient starts talking, his mouth starts moving. I click stop talking, his mouth stops talking. So you are the voice of the patient. You also have control of the dialogue of the nurse here. So Wes turns and looks at the nurse. So she can say something like,
I'm one of the ED nurses. What do you want to do next?
okay, so you have control of the dialogue there. You can also have control of the hospital operator. So let's go ahead and get the patient hooked up to get some vitals so I can show you how you can control the vitals in the case. Some of the other fun, unique animations to this case is you can have the patient hold his chest in pain. You can have the patient, I'll stop that animation. You can also have him lift up his left leg, lift up his right leg. So there are certain animations you control as the moderator. So now that the patient's hooked up and we're getting vitals, you can look over at the monitor. So you see it here or on Wes's view. The student is able to see on the monitor what's going on with the patient. Let me hop back out of that full screen view. So let's say this is a chest pain and he's a little bit unstable. So let's decrease his blood pressure by a little bit. Let's increase his heart rate by a little bit. So now he's tachycardic, he's hypotensive. Let's drop his blood pressure a little more. We could decrease his oxygen if we wanted to, so he needs to be on oxygen. Wes, why don't you go ahead and hook him up to oxygen now that his oxygen saturation is below 90. So you can see all the tools are completely functional. You have to actually hook the tubing up to the wall. You have to turn the oxygen on. Let's go ahead and jump down here. So now you can control the state of the patient. So if I wanted to, I can make him unstable, make his GCS 3, and potentially Wes would have to intubate the patient. I can also control the waveform on the monitor. So let's put him in AFib just for fun. So if Wes looks full, I'll go full screen. You can see now the patient is in AFib here on the monitor. I can obviously have him go into VFib, VTAC, any of these different rhythms. You also have control of some of the exam results live. So you can do fast exam in this specific case with the ultrasound. There's a bedside ultrasound on the other side of the bed. So as Wes is walking over there, just for the sake of this presentation, let's have the patient have right-sided pneumothorax. So Wes can remove the gown and quickly do an ultrasound of the right side and left side. So you're seeing on the right side, let me go full screen so you can see a little better. There's no lung sliding, but if he looks on the left side, there's going to be some left-sided lung sliding. You'll also notice if he picked up the stethoscope, which we won't have him do, there's not going to be lung sounds on the right-hand side. So let's jump down here. You also have complete control over the results that the patient or that the student will have in the EMR tablet. So as Wes walks over to the other side of the table and picks up the EMR tablet, I'm going to put in for some results. So just for the sake of this case, let's have it be a STEMI. We'll have it be a normal chest x-ray. CT is probably not necessary, but if they get one, let's have it be normal. CBC, let's have some leukocytosis considering the chest pain. Have a normal chem panel, normal coags, and let's have the enzymes elevated. So now if Wes clicks on the EMR tablet for lab results, you can see there's an elevated troponin. He can quickly slide through the other lab results. Obviously, these all look normal because we just put those in. If we slide over more, we can see the EKG results. We can see the chest x-ray results. You can see the CT results. And clearly on that EKG, it looks like they're having a STEMI. So let me jump back out of full screen mode. Obviously, for this patient, we need to be giving him some medication. So because he's hypotensive, tachycardic, probably should hang some fluids, probably need to give some aspirin and start him on heparin. So let's have Wes start an IV. I'll go full screen so you can see what's going on. You can see an alcohol swab, clean the area, place the IV. Also can hang fluids. And pretty much all of our cases have these capabilities. As he's doing that, I'm just going to show a few more things that you have control of. For example, as he's doing this, let's say he's a little bit slow to getting IV fluids, a little bit slow to maybe getting some medications. I could have the patient go into cardiac arrest. Before we do that, let's have him order some medications using the EMR tablet. And
hello, is this...
You can go ahead and see how those orders pop up on the Pyxis machine. So he's going to order entry. I'm going to go full screen so you can see better. So he's going to order some aspirin and maybe some heparin. Okay, and those pop up. Now we can walk over to the Pyxis machine and select those medications. Okay, you can see there's heparin. He's got to go hang, and let's just give the patient some aspirin for now. Can take off his pulse ox really quick and then hand it to him, and he's going to take the medication. So all in all, there's a lot of capabilities. Wes, just to show off some of the other things, let's have you go over and open up a couple of the kits. So there's an intubation kit, and as he's doing that, I'm going to have the patient go into cardiac arrest. So now the monitor is pinging. Wes is concerned. He can check pulses really quick. If he had that pneumothorax still, we also have a chest tube kit. He needs to tell the nurse to start...
Hey, Meg, can you start chest compressions, please?
Chest compression, so he'll turn to the nurse and say, hey, let's start CPR. And I'll have her walk over and start chest compressions.
Starting chest compressions.
That just about wraps it up. You're seeing all the capabilities in this case. You can control all the results live during the case. You can change results, control the dialogue, control the computer player in the case. I hope you enjoy, and excited to have you try it out yourself.
An immersive room is a room with moving images on all walls. The walls respond to human touch. There is surround sound, and even smoke or smells might occur. Everything has been designed so as to move you to an alternate reality. A scenario in which to train staff, a game to entertain people, or an experience intended to educate. Thanks to the interactive options, the visitor is able to influence the way the experience unfolds. An immersive room can be installed just about anywhere, as a freestanding space at a trade fair, in an office building, a festival tent, or in a mobile location such as the back of a truck. FixVision designs immersive experiences that offer endless possibilities, both educationally and as entertainment. We challenge the participants with interactive games. We immerse them in a manufactured reality and present them with challenging assignments.
Everything a computer game has, our experiences have too.
Puzzles to solve, objects to select or move, information to track down, and questions to answer. Together, the participants respond to what comes at them in the room. The possibilities are endless. Want to know more about the possibilities of a custom immersive experience? Contact us to get a demonstration. Fix Vision, immersive content creators.
This video describes the Noel 550 and 551. For much more detail, please consult the instruction manual. The Noel 550 includes the mom, the fetus, and the newborn. The Noel 551 is just the mom and the fetus. In both cases, the mom is fully capable of BVM, CPR, and intubation. Both have bilateral IM sites in the shoulders and thighs. They also include an IV arm, so you can do life support protocols. The delivery mechanism provides deliveries as short as 1 minute and up to 30 minutes. It has fetal cardinal movements, internal rotation, translation, and external rotation. Noel's tummy cover includes speakers that play fetal heart sounds that can be heard with a stethoscope. Noel also comes with a placenta that can be placed in the upper or lower abdomen. Similarly, you can place the placenta so a fair amount of traction is needed during the delivery. Noel's cervix dilates automatically as the fetus moves down the birth canal, starting out at 1.5 to 2 centimeters and dilating as the baby progresses down the birth canal. During delivery, the fetus begins in ROA position and rotates while moving down. When shoulders are completely delivered, the motor turns off. The students should then remove the fetus from Noel in a normal fashion and proceed to birth the placenta. The umbilical cord can be clamped and cut. Students can also practice episiotomy repair. Noel comes with an inflatable base that, when placed into the abdomen, lifts the baby to facilitate Leopold maneuvers. The birthing fetus is highly articulate and can be placed in transverse, normal, or breech positions. Once ready to begin the Leopold maneuvers, you should determine if the head is up or down by palpating the spine, elbows, and knees. Noel is operated by the Omni controller, which manages both delivery and CPR monitoring functions. The neonate can be intubated orally or nasally. Students can perform CPR and provide medications through the umbilical cord. The upper torso contains the heart, lungs, and ribcage, providing anatomical landmarks. The Noel 550 includes full-size simulator, automatic birthing mechanism, articulating fetus, placentas, removable cervices, base for Leopold maneuvers, Omni controller, CPR link software and cable, Volvo inserts, and intubatable neonate.
Het grote verschil door op deze manier te trainen is dat het gewoon echt heel reëel is. En dat maakt het ook leuk.
Ja, het is realistisch. De patiënt ademt en goed, we kunnen pop tegenwoordig ook laten ademen. Maar de ogen gingen open, ja, het was zo reëel, maar je kon ook meteen handelen.
Het idee heb dat ik echt met een echte patiënt te maken heb. Als ik bijvoorbeeld een reanimatie moet toepassen op een pop, blijft dat voor mij een pop, een schone, mooie pop. Maar zo is het in realiteit niet.
Nu zie je de dingen ook levensecht. Dus zit je ook meteen in die situatie en ga je handelen.
Deze nieuwe manier van leren maakt mij nog enthousiaster en je krijgt ook de kans om dingen uit te proberen.
Wij denken ook dat die nieuwe innovaties op het gebied van leren ook ervoor zorgen dat mensen plezier houden in het leren. En dat ze daardoor ook meer betrokken zijn bij hun eigen leerproces.
Deze manier van trainen nodigt zeker uit om zelfstandig te gaan oefenen. Zodra je een momentje tijd hebt, kun je die bril pakken, opzetten en gaan oefenen.
Nou, deze manier van leren draagt zeker bij aan werkplezier. Door op een andere manier om te gaan met leren en werken.
Op het moment dat ik kan trainen waar ik behoefte aan heb, is het voor mij makkelijker om ook te trainen op de dingen waar ik niet bekwaam op ben.
Step into a different world together. In a computer-simulated alternate reality which blurs the boundaries between reality and fiction. Challenge yourself and test how you and your fellow players respond to unexpected situations.
In an immersive room, you're surrounded by visuals, sounds, lights, and smells. Prepare for major engagement of the senses in this serious gaming experience.
Respond together to what's coming at you and celebrate your victory at the end. Fixed Vision creates immersive experiences that offer endless possibilities, both educationally and as entertainment. Our team of scenario writers, designers and programmers has worked hard to create an unforgettable experience, full of interaction, immersion and sensation for you. Want to know more? Contact Fixed Vision. Immersive content creators.
Hey guys, sorry it was kind of a rush load up there. I'm Shri, this is Rivera. Hey.
I'm Wesley Glover. I was the medic for Clark's unit.
Yeah, do you want to tell me what happened?
Clark was in the middle of a firefight. It looked like there had been a nearby explosion and we pulled him out from under some heavy debris.
Okay. Looks like you dropped the tube?
He wasn't responding well and vomited shortly after extraction, so we intubated him for airway protection.
Got it. What'd you give him?
I used ketamine for the intubation.
Okay. Did you notice anything else on him?
On my exam, he had a few cuts and scrapes, but nothing too bad. I think he might have something intracranial. Hopefully we can get him back in time.
Yeah, nice work. We're gonna go ahead and do a secondary and we'll take it from there.
Okay.
So far from what I could see at the head to show, I didn't really see any significant abrasions, no deformities anywhere, no ecchymosis. We can probably go ahead and try rolling.
Yeah, I'll roll him. Alright, so I don't see anything on the back here. No external signs of trauma there. No step-offs. No tenderness, no, obviously. But no step-offs at least.
Right.
Okay.
Just rolling back?
Yep. Alright, oh!
Oh boy.
Alright, I think the ketamine's starting to wear off. Oh, it looks like you might have lost his IV somewhere along the way too. Let's go ahead and, drop an IO in him.
I got an IO right here.
Yeah, nice.
Alright,
Okay.
here we go.
You want to hit him with some ketamine?
Yeah, definitely.
Alright.
Here we go.
He's pretty tacky. Oh, he's a little hypotensive too.
Alright, there we go.
Okay.
Whoa, 38 over. I don't have pulses here,
Ooh,
actually.
I don't have pulses either.
All right.
Okay. Hey guys, start CPR. Alright. Can you take a listen to him?
Right, yeah.
I'm gonna put pads on him here. Okay. I've got, rate 136. I'm gonna charge him up.
I can't. There's too much prop wash. I can't hear anything.
Okay. Alright, I'm gonna shock him.
Alright.
Alright, ready?
Wait, hold on, clear.
Alright. Okay. Check pulses?
No, nothing.
Yeah.
You know, this looks like a sinus rhythm on the monitor, so I think he's in PEA.
Oh, you're right. Alright, alright, you know what? Let me take a look.
Let me get him some epi.
Okay. Okay. I'm just seeing if he's got any bleeding.
Epi delivered.
Okay, I don't see any free fluid in his belly. Let me try to sneak in here and take a look at his heart.
Heart looks good.
Yeah, I mean, it's fluttering, pumping. That lung. Ooh. I think he's got a. You know what? He's probably got a tension pneumo.
Yeah, there's not very good lung sliding there for sure.
Yeah.
I got a 14 gauge needle right here.
Okay, why don't you pop it in?
Patient's right?
Yeah.
Okay, here we go. I'm gonna put this in the second intercostal space.
Great. Okay. All right. All right. Let's hold CPR. Check pulses. See if we got anything better.
Hold CPR, guys.
Okay.
Nothing.
Nothing.
Okay, restart compressions.
All right. I think we probably have to do chest tube.
Yeah, I think you're right.
Okay. Here, you want to give me some Chlorhex real quick?
Okay.
Okay.
Okay, I got a scalpel. I got a.
Okay, you do it. Here, you got
Alright.
sharp in the field here.
Okay, hold on. Hold compressions for a second here. Okay, there we go.
I'm gonna put a finger in them. Okay.
I got a tube all the way. That sounds good. Sounds good. Okay, here we go. Yeah, he's got bounding pulses right now.
Whew. All right. So,
he's still a little tacky. Why don't we give him a little bit more ketamine? Or actually, I got some fentanyl right here.
Yeah, let's give him something for that.
There you go, buddy. Now you want to recheck him on the ultrasound, see if the lungs come back up.
See, so it looks good. Well, he definitely doesn't have a tension pneumo anymore.
Okay.
Okay. I mean, he still has a bit of a pneumothorax, but
it'll take a bit to come up.
Yeah, I think the lung's just not up yet, at least that area and anteriorly. But you know, look, he's got pretty good squeeze.
Yeah.
Yeah. So I think he's
all right.
He's better. Okay.
Woo. Okay. Well, thanks so much for your help, guys.
Thanks.
Yeah. All right. Well, let's get him covered up and get to base.
Wist je dat meer dan 70% van de fouten in de gezondheidszorg veroorzaakt worden door menselijke factoren, zoals gebrekkige communicatie of het stellen van foute prioriteiten? Deze fouten worden meestal veroorzaakt doordat verschillende disciplines, zoals verpleegkundigen, artsen, ergotherapeuten of administratief zorgpersoneel, niet goed samenwerken. Het is dan ook belangrijk, maar niet evident, om voor hen een teamtraining te organiseren in een authentieke werksituatie. Daarom organiseren we in ons simulatie-observatielab teamtrainingen waarin we deze authentieke situaties kunnen nabootsen en aan de hand van camerabeelden de situatie kunnen analyseren en nabespreken. Simulatietrainingen kunnen nog aan realisme winnen in een immersive room. Daar projecteren we 360 graden beeldmateriaal rondom de deelnemers en kunnen ook rook, geur en wind worden gesimuleerd. Op deze manier kunnen we de setting creëren van een bos, een ziekenhuisafdeling of eventueel een lokaal treinstation. Deze immersive room biedt dankzij de interactieve wanden de mogelijkheid een groep diverse deelnemers samen te brengen in een veilige, authentieke en gestandaardiseerde leeromgeving om een serious game te spelen. Deelnemers treden in interactie met elkaar in deze shared VR-omgeving, waardoor het leren van elkaar wordt gestimuleerd. Immersive simulaties en serious games bieden dus heel wat mogelijkheden om een zorgteam samen te brengen en samenwerken te stimuleren. Op deze manier trachten we dus de 70% fouten die veroorzaakt worden door gebrekkige communicatie of teamwerking te reduceren.
Welkom in de Situation Room.
Hey, wat zou jij bij aankomst van je collega's willen weten?
Op een intensive care liggen ernstig zieke patiënten. Patiënten waarbij alle vitale functies moeten worden ondersteund. En die zorg wordt geleverd door een team van heel diverse samenstelling. Dat zijn verpleegkundigen, artsen, operatieassistenten, anesthesiemedewerkers, defensiepersoneel. Allemaal professionals die individueel op hoog niveau geschoold zijn, getraind zijn om hun werk goed te doen. Hun taak uit te voeren.
Van harte welkom. Heel leuk dat jullie hier willen zijn vanmiddag. En we gaan vandaag een scenario training doen. En dat houdt eigenlijk in dat we mensen dus in een situatie gaan plaatsen waarin ze als team moeten gaan samenwerken. We maken daarbij gebruik van een pop die als de patiënt gaat gelden. En wat we het allerbelangrijkste vinden is om te kijken hoe er onderling wordt samengewerkt. Dat gaan we pas doen nadat we ze eerst een stukje theorie hebben meegegeven. Zodat ze een klein beetje weten wat er van ze verwacht mag worden.
Sommige fouten niet gemaakt mogen worden. Toch maken we ze. En dan is de truc, en ook dat is CRM, als je weet dat die fouten op de loer liggen, probeer dan een systeem eromheen te creëren waarin je de consequenties van die fouten zoveel als mogelijk weet te beperken. Dat is uiteindelijk
oordeel die kan ook totaal verschillend zijn, dus door je achtergrond van.
Op een IC gaat het altijd op het scherp van de snede. Dit zijn hele zieke patiënten. Kleine missers kunnen hier een groot gevolg hebben. Je moet echt samen proberen het schip zo goed mogelijk op koers te houden.
Hier is al heeft hij morfine, rhodonium, wat noradrenaline.
Je kan het trainen door zo dicht mogelijk in de buurt van de realiteit te komen. Door mensen het gevoel te geven van hé, dit is waar ik voor sta. Dit is wat ik moet doen. Maar wat moet ik nou? Laat ze dat maar voelen. Laat ze dat maar ervaren in een veilige omgeving hoe je elkaar kan helpen.
Als je dit soort oefeningen doet en met elkaar even goed nabespreekt wat maakt nou iets tot een succes geworden is, dat ons nog beter leert om nog beter samen te werken. Wat mij betreft blijven we dit ook doen.
Ja, ik denk dat het heel belangrijk is. We werken hier met verschillende mensen, met een team waarmee we eigenlijk anders nooit samenwerken. En zeker in stressvolle situaties kan je veel dingen uit een protocol leren, maar het doen is echt een tweede. En ik denk dat je dat echt alleen maar leert door het een keer te oefenen.
Ik heb met name wat dingetjes over mezelf geleerd. Even hoe reageer ik in zo'n situatie. En ook gewoon wel wat kan ik verwachten van mijn collega's waar ik mee zo dadelijk ook weer gewoon op de zaal sta.
Samenwerken doe je niet alleen. Om goed samen te werken moet je weten van elkaar wat je kan. Moet je elkaar leren vertrouwen. Moet je vooral ook goed kunnen communiceren.
Ik denk dat dat een van de kernwaarden is van deze training. Het dingen kunnen uitspreken. Het goed zorgen voor elkaar op alle vlakken. En er inderdaad met z'n allen als team wijzer van worden.